More synovial joints on Fridays, right? A lot to absorb each time. Okay, some bones have sinuses in them. Tell me a function of a sinus. Why do I want a sinus in some bones? Lightens the load of the skull. Okay, my glasses right now are sitting on what bones? Nasal bones. Do your nasal bones have sinuses?
No.
No.
Does anybody have sinuses in their nasal bones?
No.
They don't. What bones have sinuses? Frontal,
Frontal.
ethmoid, maxillary, and sphenoid. You're gonna remember FEMS. Okay, is one function of sinuses to allow the baby's brain to grow? No. What allows the baby's brain to grow? Those are fontanelles. Fontanelles are those membrane-filled spaces where the bones haven't ossified. So when a baby is born, their brain is still growing. So allowing the baby's head to grow, remember, is not sinuses, that's a function of fontanelles. Okay, cranial bones have fixed joints between them. What do you call all the fixed joints? Sutures. What if on the test they say, name the suture between parietal and occipital bone? Lambdoidal. Name the suture between parietal and temporal? Squamous. How about between my two parietal bones? Sagittal. Don't say mid-sagittal, just plain old sagittal. And how about between frontal and parietal? Coronal. Very good. Okay, I just broke a bone. Okay, when you break a bone, there's 4 in order parts of the repair process. What is the first step in a repair process called? Okay, hematoma, okay, repairing the hematoma fracture or hematoma repair. That's the first thing. Some clotted blood forms at the injury site. The second step is there's a massive repair tissue that goes to that injured site. It's a hard name. The second step is called fibrocartilaginous callus. So we form a fracture hematoma, clotted blood, that's step 1. Then we do repair tissue, hard name, fibrocartilaginous callus. The third step is called a bony callus. What's formed in the bony callus? Spongy bone, which forms in 1 week versus what's the final step in bone repair called? Remodeling, and that's when you form compact bone, which takes a lot longer.
6 to 8 weeks.
Yes. Now, there's about 6 bone fractures you have to know. I know there's 25, I picked 6. You just twisted your ankle, it's a sports injury. What kind of fracture is that? Twisted, spiral. Your grandmother fell and broke her femur in 4 places. An elderly person fell and broke their femur in 4 different places. The bone broke in many different pieces. Comminutive. A child broke a bone, but oh my gosh, half the bone is bent and the other part's still straight. Green stick when that happens. Wow, very good. 2 ways you and I can make bone ossification. One way, bone forms on top of dense fibrous connective tissue. That's how all my cranial bones formed. That's how my clavicle formed. When you form bone on top of fibrous connective tissue, what's it called? Intramembranous ossification. But most of your bones from the neck on down didn't form that way. You had cartilage, and then the cartilage was replaced by bone. So when I say, how do most bones form in your body? By endochondral ossification. Okay, in order for my bones to elongate and grow taller, there's a certain hormone I need. Growth hormone. Growth hormone, good. I want to know, and this, I'm asking the hard ones now. Most of your calcium in your body right now, is it mainly in your blood or in your bone? 99% is in your bone, only 1% is in your blood. Could I make my blood be 0 calcium? Do I need that calcium in my blood? I must have it in my blood. It's for muscle contraction, it's for blood clotting. So if I said to you, you need to put more calcium in your blood, what type of cell breaks down bone tissue and puts the calcium in your bloodstream? What are you going to pick? Osteoclast with a C, very good. What type of bone tissue, what type of bone cell builds all your matrix of bone? Blast. And once you build it, what maintains the bones nice bone. Osteocytes. Osteocytes. And if you have a bullseye, a circle within a circle, we call that, each bullseye has a special name. What do you call it? Osteon. And do you know the 5 parts of the osteon? Have you seen the 3D models in lab, the osteon? So the bullseye, circle within a circle, is there a name for the smallest circle in the middle? Central canal. What's in your central canal? Artery, veins, and nerve. What do you call the mature bone cells that are on the rings? Osteocytes. What if I say name the space where a bone cell lives? Lamella or lacuna? It's confusing. Lacuna. Lamella, I asked both on the test. Lacuna is the space where a bone cell lives. Lamella is the matrix of bone. And someone says to you, hey, describe the matrix of bone, how would you describe it? Rock solid, right? There's a whole bunch of calcium inorganic salt compounds, which I said, don't worry about the 18 names, just collectively recognize hydroxyapatites. Remember that word, hydroxyapatite? This is, you know, this is a lot of difficult material. Okay, what's the most common type of cancer? Melanoma, no, we don't want that. That's the worst one. The most common type of cancer is called basal cell carcinoma. And just be as close to the beginning of the alphabet. Basal cell carcinoma is the most common type of cancer. It's about 100% curable. What's the worst kind of cancer to get? Only 1% of people get this when they get skin cancer. That's the melanoma. Okay, I'm looking at a mole right now and I'm wondering if I should go to my doctor or not. The mole, this one mole, is different shades of brown. Does that matter if it's different shades of brown?
No.
Yes, it does. Your mole should all be one color, if not, you're calling the dermatologist. The mole should be smaller than what? The pencil eraser, okay? And when I look at the mole, I'm looking at the outside, how it is. It shouldn't be jagged, it should be uniformed in appearance, okay? And if I look at a mole, split in my mind, the right and left side, your book says there should be symmetry. The right side should look just like the left side. I'm working at a fire station now, and I was called out because there was a terrible fire, and we got all these patients to take care of on the ground. What's the rule that estimates how we figure out how badly burned each body is? Rule of nines. No one should miss that, rule of nines. What if I said a child was deficient in vitamin D? What disorder do they have? They don't have enough vitamin D. Their bones are very deformed. They're lacking vitamin D. Rickets, very good. Wow, someone's been studying. I'm trying to catch you on some of these things. Okay, now, when you think about connective tissue, how did connective tissue get its name, the different types of connective tissue? For connective tissue, do I look at number of layers and do I look at cell type? No. When I ask you how did connective tissue get its name, you look at the matrix. And you're right, they always have fibers. Okay. If you have a fluid matrix, that's how I'll say it on the test, what connective tissue has the fluid matrix? Blood. Which one has a solid gel matrix? Cartilage. What has a rock solid mineral matrix? Bone. And then the hard one, the one that's semi-fluid, semi-soft gel, that's that connective tissue rock. What if I said tendons and ligaments? What kind of tissue makes up tendons and ligaments? Dense, fibrous, connective tissue. If I said elastic cartilage, give me one place I could find some elastic cartilage. Making things flexible. They both begin with an E. My ear, and what prevents me from choking? My epiglottis. Very good, very good. Okay, true or false, remind me. Your adipose tissue doesn't have a nucleus. False. Adipose tissue looks like there's no nucleus because adipose, the fat, pushed the nucleus in the cytoplasm to the sides of the cell. So adipose tissue does have a nucleus, it just doesn't look normal because there's so much fat, it pushed it to the side of the cell. All right, epithelial tissue, highly vascular or not vascular? Not. I can scratch here, nothing, epithelial tissue is known for not having blood vessels in it. So, because of that, wherever there's epithelial tissue, what did I say would always be underneath it?
Connective tissue.
Connective tissue. And what separates the epithelium from the connective
The
tissue?
basement membrane.
Okay, people have been studying, I like it. Okay, fibers. Do I think of fibers as being, listen to the question, in epithelial tissue, connective tissue, or both? Where do I find fibers?
Connective?
Only connective tissue. There's 3 types of fibers: the strong white fibers that make up the white of your eye, collagen; the flexible ones that allow stretching, elastic; and the ones built into soft organs, so even a spleen or a lung, a soft organ that is a muscular, still has a shape. Reticular. I made the test very straightforward. I don't know the difference between endocrine and exocrine. Endocrine are ductless glands, right? And exocrine have a duct. Okay, if I said to you, lacrimal glands or mammary glands, are those endocrine or exocrine? They're exocrine, they have a duct. Because if it's an endocrine gland, it's gotta be a gland that secretes hormones. If it doesn't make a hormone, it's not an endocrine gland. Okay, I've heard of the word keratin. What do you know about keratin?
Waterproofing.
Waterproofing protein. Name someplace I can find keratin.
Skin.
Skin, hair are wonderful places I can find my keratin. Very good. Okay, cilia. Could I see cilia with squamous epithelium?
No.
Never. How about cuboidal?
No.
No. How about columnar?
Yeah.
Yes. Is all columnar ciliated? No. If it does have cilia, it's gonna be to catch dust particles or debris like in my respiratory tract or sweep something along. Your digestive tract, is that simple columnar ciliated or non-ciliated?
Non-ciliated.
Non-ciliated, very good. Okay, what if I said to you, underneath your epidermis is your dermis? What are the 2 layers of your dermis? Papillary and reticular. Here comes the hard question. What is the major type of tissue that makes up your dermis? Irregular DFCT, dense fibrous connective tissue. Last question, hypodermis. Hypodermis is under the dermis. Give me the 2 tissues that make up your hypodermis, under your skin. AA is how I remember them. Areolar and anaphylous. Keep studying, it's coming. Come back Friday, I know it's a Friday, don't take off Friday.